For my human anatomy project, I chose asthma as my topic. My human anatomy question was, what is asthma and how does it affect people? Asthma is a chronic inflammatory disorder of the airways. As you can see, when somebody has asthma, their airways are inflamed or swollen up, so there's less space for the air to get through. And during an asthma attack, the muscles of the airway tighten up, trapping the air in the alveoli, making it harder for that person to breathe, almost impossible for them to breathe. One of the things that characterizes asthma is the recurring symptoms of wheezing, difficulty breathing, chest tightness, and coughing. People with asthma can get any one of these symptoms just from doing any normal day thing that might trigger their asthma. Asthma can be triggered by many things, such as breathing in cold air, emotional stress that might cause you to breathe harder or faster, breathing in allergens like pollen, breathing in environmental pollutants, exercise that might cause you to breathe harder or faster, respiratory infections, or the use of medication and illegal drugs. Even things like aspirin and food preservatives can trigger asthma. There are multiple different types of asthma. One of them is intrinsic asthma. Intrinsic asthma is more commonly triggered by things like breathing in cold air, emotional stress, or just breathing in chemicals or things that would bother your lungs or airways. Another type of asthma is extrinsic asthma. Extrinsic asthma is more commonly triggered by breathing in allergens like pollen. Another type of asthma is status asthmaticus. Status asthmaticus is a severe and prolonged type of asthma. This type of asthma does not respond to normal treatment. If you have status asthmaticus, you need to receive aggressive treatment. If you do not receive aggressive treatment at a hospital, it could cause a respiratory failure from hypoxemia, which is where it doesn't get enough oxygen, hypercapnia, which is where it gets too much carbon dioxide, and acidosis, which is where your body overproduces acids from there being too much carbon dioxide in the blood. Another type of asthma is childhood asthma. Childhood asthma is, you only have it when you're a child, and it is more commonly triggered by inhaled allergens. There is one test that doctors can run to confirm a diagnosis of asthma, and that is called the challenge or bronchial provocation test. During this test, your doctor would give you something to inhale that would bother your lungs. Then they would test how responsive your lungs were to the substance in your airways. If your lungs were hyper-responsive or super responsive, you would have asthma. If not, you didn't have asthma. To test how bad your asthma is, they run a test called the pulmonary function test. During this test, they measure how much air your lungs can hold during a forced breath. Then they measure how long it takes you to fill up your lungs during a forced breath. From that, they can determine how severe your asthma is. Using an inhaler can treat an asthma attack. During an asthma attack, the muscle around your airways, called the smooth muscle, is tense and it starts to close the airways. The chemicals in an inhaler act as stimulants to calm and relax the muscle, letting the airways open up again. 14 to 15 million people in the United States have asthma. 5% of all adults have asthma.